Hello. The topic of today's presentation is that I would like to tell you that how to what are the different study materials for a Morth Part A. Because previously I shared it on the Telegram group that what to study, but even then there are many candidates who contacted me that but where to download it, the topics, right? So there was some confusion, so I decided to make a presentation. So first of all, the three books, right? And I'll try to share the books. The first one is the Bristol Notes, the 9th edition, right? So this is one of the basic book. The second one is Clinical Cases in Orthodontics. And the third one is Handbook of Orthodontics, 2nd edition. So these are the three basic books. Sometimes previously candidates have sent me a message that should we read the Plant of Orthodontics or should we go for Al-Muzian Notes, or should we go for Introduction to Orthodontics by Laura Mitchell? There's a book by Fleming. Should we go for that book? So the simple answer is yes, you can go for every book, right? But it depends on how much time you have. If you have 3 months left before the exam, then you should do the Bristol Notes, Handbook of Orthodontics and Clinical Cases in Orthodontics. If you have 6 months, 8 months, then you can go for more books, right? Because no one can stop you to get extra knowledge, right? Every book has some extra knowledge which is not written there. But if you're short in time, like 3 months, you're doing a job and you do not have all the time in the world, right? So these are the three basic books which every candidate should read. And if you read these three books, and if you have a good training, if you have exposure to MCQs, there's a good chance of passing the exam, right? So you can go for all other books, but for that you must have time. So these are the three basic books one must study. Then coming to the, I'll try to share the page. Then the guidelines, right, for the clinical. Okay, so Royal College of England Dental Guidelines, you will type Royal College of England Dental Guidelines. It will take you to clinical guidelines or clinical guideline dentistry. So guideline for the extraction of first permanent molars, management of palatally ectopic maxillary canines, and management of unerupted canines. These are the three most important guidelines, right? So anyway, these are the three guidelines you have to study from there. Then you have to go for STSEP, right? You go to the website STSEP. One, the most important is STSEP drug prescription question guidelines. Okay, I accept this. So you have to go through all three of them, right? But this is a 3rd edition, and then there are 2 updates. But these are 2 pages, 3 pages. So read all of them, right? They will cover the drugs, and they will cover the the medical emergencies, right? Then sterilization, right? As is sterilization of dental instrument. So you have to go through these ST-step sterilizations, right? You simply have to type and it will take you on the ST-step sterilization. Then are the IEDT guidelines, right? So there are 3 IEDT 2022, right? And let me check if I got with them ST-step mouth activities. Okay, party waste management trauma. Okay. So you have to go through the IEDT, but you can download it from the website, right? So this is one fracture and luxation. I'll close other ones. So this is the one. So 2020 guidelines. And then the second one, injuries in the primary dentitions. And then the third one, avulsions of the permanent teeth. And the fourth one, guidelines for the orthodontic management of traumatized tooth. So you must have all four of them, right? And many times things are overlapping, right? So just get all four of them and go through them. Give a read, like, but you will find many overlapping things, especially the last one is a main one, but there are few smaller things written in the other ones. So go through them, right? So they give some questions regarding um, uh, safety signs. So you can download one by finding it. September 2023. So for science, trauma, safety science. So you have to get this. This is a free booklet from HSC, right? The Health and Safety Executive, Safety Science and Signals. So you have to download this one. And then for aligners, yes, for aligners, you can easily find the smart force features and attachments, right? So from Invisalign, this is free. You can download it, right? Because there are few things which are free, or there are other things which are paid. I do not want to share this, like, but I can easily do it by Dropbox. But I do not want to make it public because for some there's a copyright issues, right? So I do not want to become a victim of any but problem. So for clinical audit, this is basically the document. It's quite a big document. And if you work with someone, they will tell you. So it's a Royal College of England document for the clinical audit, right? Methodologies of clinical audit in dentistry. For the basics, so there are, we know that core modules from BOS, right? The most important, I think, is for materials, right? One must have this. This is a 2004 core module. One must go through this if you want to cover the material topic, right? And you can also go for radiology. But if you have done like a 2016 radiology guidelines from BOS, I will show you the BOS. Yes, subcommittee norms, no, all basis norms. So on the BOS side, British Orthodontic Society, radiology. So these are free guidelines on the British Orthodontic Society for Radiology. Go ahead, go. Okay, sometimes they do not open up in my country and I have to apply a VPN, but these are the radiology guidelines. Okay, they didn't open. Radiation protection. So these are the guidelines, right, by Azitson. These are the BOS guidelines. These are important, right? One must study them. And for needle stick injury, like what you can easily get these things from the NHS website, right? And for the consent needle stick injuries, one must, if you're sitting in the Edinburgh exam, go for the Scottish guidelines. If one is sitting for the England exam, go for the British guidelines, right? Like, but if you're sitting for the Royal College of England, then it's the FDGP guidelines rather than the SDCEP guidelines, right? So even on the SDCEP, there's needle stick injury guidelines. SDCEP, yes, including shops, right? So SDCEP have these guidelines, but you can easily also type like but needle stick injury protocol NHS, right? So what should I? So the NHS site is a very good resource when you're going for vaccination, needle stick injury, like, but you can type this and you will get it from NHS, right? So this covers that. Covered clinical audit. Um, Nothing on, like, but they do not give you any tumors, these things. And waste management, you can also do it from NHS website. You can, like, but this is a, okay. So I for the this one, like, but for Scotland, there's a slight difference between England and Scotland for waste management. So I use this one for the England waste management. This is from, as you see, Health Facilities Scotland, right? So this one is if you're sitting the Edinburgh exam. So they've given like what to dispose of and where to dispose of. So there's slight difference between when it comes to Edinburgh versus England for waste management. And for Perio, yes. For Perio, again, the British Society of Periodontology, they have documents on the website. They're all are free, right? So basically, one must have a good idea that what is basic periodontal examination. So you can go to the BSP website to get for the basic periodontal examination, both for the children and the adults, right? So that's also free. So I think that's got most of the things. Like, but these are the further documents, for periodontal and gum disease, flowchart implementation, right? So these all things are present on the British Society of Periodontology. So you can get them free from there. I hope that would be useful.